Well, good afternoon, everyone. My name is Mark Goldstein. I'm the chairman of UCSF Health Hub, and I'm here to present probably our most exciting semifinalist panel of them all, which we call them the COVID Patriots. These are the semifinalists for the UCSF Digital Health Awards. Our grand finale is next week, and before we get going and walk through an agenda, I'm going to show you a little video.
Welcome to the second annual UCSF Digital Health Awards 2020, the Academy Awards of Digital Health, where we honor the best technologies that are defining and leading the digital health revolution.
We want to improve healthcare, so we're really excited to be part of this wonderful evening.
Collaborators include the top healthcare incubators, accelerators, and venture capitalists across America, featuring the top 100 digital health innovators in the country selected from over 1,000 entries, 15 curated award categories, hundreds of judges selected from the healthcare community, healthcare industry thought leaders, thousands of online attendees, and dozens of virtual events, culminating in the September 23rd finals, honoring those who are reshaping the industry and making a difference in the COVID pandemic.
Join me, Qventus, as we honor the role digital healthcare plays in rewriting the future of health.
And the UCSF Digital Health Awards is narrating that future. Join us on September 23rd at 6 p.m. Pacific time for a 90-minute celebration as we honor these winners, changing the future of healthcare.
Excellent. And there we go. Hey guys, we're back. I'm going to walk through a bit of our agenda, what our plan is for today, and we have a lot to accomplish, and we're going to try and do it in 45 minutes. Maybe we'll go to 50 or so. First of all, our agenda, introductions. I have two co-moderators that are going to be joining me, and I'll be introducing them later. We're going to have 3 separate roundtable discussions. We have 12 total companies in this round, so there'll be 4 in each of the roundtables. Then we're going to have some questions from the audience after we've peppered them with a few of our own questions in a roundtable. And then we're going to go into a closing. The objective today is really simple. It's threefold. We have about 200 or so people live. We basically expect quite a few hundred people to look at the recording, but a big part of this is to get to the judges. We have a lot of judges that want to associate a name with a company. And your submissions have been amazing, but this is the final piece of the puzzle that's going to really help them make the selections and to pick the winners. So I'm the founder of UCSF Health Hub. I'm also a full-time venture capitalist. So I'm a volunteer at Health Hub. We're all volunteers here. And Health Hub is sponsored and supported by the venture capital community. We have about 22 venture firms that give us donations. We're a nonprofit. And those donations go to helping companies, specifically in digital health, helping them scale and grow. We'd be doing this from Mission Bay in San Francisco. Obviously, we're not doing that today, but our perception, and I think everyone's perception, is UCSF is at the center of healthcare innovation, and that's where we are. We think that this is our second annual health award show. We are planning this to be the Academy Awards of digital health and of healthcare in general, and it's just one of the many things that we're going to be doing at UCSF over the next few years. Before we get into this, super important thank you to our sponsors. The awards event could not happen if it wasn't for our venture capital sponsors and Wilson Sonsini, who I know a number of you either know or love or know well of. NTT, the huge Japanese telecommunications company, owned by Novartis. Novartis's accelerator and incubator, Silicon Valley Bank, and one of our winners last year, Livongo. Without them, we would not be putting this on, and we thank them. These are also some of the venture firms that are behind Health Hub and are on our board of directors. So how did we get here? What we got here is there are 15 categories in our Digital Health Awards. Obviously this year, COVID was really everything. It crowded out the room. It was the elephant. It was all anyone, and for good reason, talked about. We created a special category for COVID, but we have 14 other categories that cut across digital health. Let's talk about what we did in COVID. We had probably 225 companies submit applications to get one of our COVID Patriot Awards. We have gone through this application submission process now for over 3 months. We had a first round, we had a second or quarterfinal round, and we had a semifinal round. In those submissions, all of you companies put together really great submissions, detailed explanations as to why you were great and why what it was you were doing really mattered. We have 250 judges, and of those judges, they are included practitioners and physicians from UCSF and healthcare institutions around the country, venture capitalists, analysts, leaders of health organizations, and basically anyone that we felt qualified that could put up their hand and says, I really know a lot about digital health. Those judges are the ones responsible for the voting. We've gone through a process. In our second round, which is what we've recently gone through, we focused on, we gave, every company had up to 50 points. The companies that made it to this second round were all validated. We felt that these were companies that were in market. These were companies that had solutions that we could then, after the awards event, recommend not only across the UC system, but to healthcare organizations around the country, if not the world. So of the 50 points, 10 points went for the value of the customers. How important what it is what it is you're doing. 10 points went to innovation. Are you innovative or are you just a fast follower? Level of validation. Have people really use this product? If FDA is applicable, do you have your FDA approval process? What about clinical trials? Traction. How many people have you touched? How many people have used your solution? And then how are you different? Combination of all those things resulted in you all being winners, all being really important solutions. So we've split today into 3 categories. Best diagnostic testing solution for COVID, best patient engagement solution, and best delivery and best delivery and decision support solution. And Bob, are you amongst us? Are you out there?
I am. Hi, Mark.
Excellent. We are lucky. We have Bob from Venrock. I will give a very short introduction and then let him introduce himself. Bob has been is one of the pioneers, if not one of the key pioneers of digital health. He's made some incredible investments at an incredible venture capital company. And without that, Bob, I'm going to let you tell everyone here more about Venrock and about yourself.
Well, good afternoon, everybody. Thank you, UCSF and Mark, for putting together a really important event to recognize the work of so many of these companies. I had the privilege of, for the last 4 months, to work with Governor Gavin Newsom to help the state of California mobilize our COVID response. And I spent most of my time working on ramping up testing in the state of California. And I got to see the benefits firsthand of the work of many of the companies that we're going to recognize here. And I have to say, I'm so thankful and we're so blessed as a state and a country that we have created an ecosystem of companies that can miraculously scale to meet the challenge that we all faced in March and April to care for patients with COVID-19, to get PPE to the clinicians that needed it, to get testing into the communities where we needed it, to quickly mobilize to do clinical trials to learn how to better treat these conditions. And hopefully we'll also learn how to administer vaccines at scale much more quickly and effectively than we have before. And part of what made our response in California hopefully better was that we have around us many of the companies that we'll talk to who I was able to reach out to and ask for their help. And they not only took the call, but they did great things to help California and our country, and have been role models for other states and for the federal government. Now I'm back doing mostly my day job of trying to help, meet the next generation of entrepreneurs and help our portfolio companies continue to grow faster and achieve more. And so it's just a real privilege to get to be here and to meet with these semifinalists and to support the work of UCSF. So thank you for having me.
Absolutely. So these are the questions that you as companies, you've all answered. You've answered really well, and they're all reflected in your in the one pagers we put together for you. But we thought this would be important to show those that are on the Zoom call now and our judges to remind them these are the questions we asked. What's unique? What's your journey? What's your validation? And where are you going? Bob, I'm going to turn it over to you to make these introductions.
Sure. So we have a pretty extraordinary group of diagnostic testing companies today that we'll be hearing from. We have Kocher, Scanwell, OneHealth.io, and Mammoth Biosciences. Mark, we're going to have each company now in turn share. Is that so?
Yeah, exactly.
They're in order that you would like.
Yeah, they're in that order, and the Kocher one is easy. I guess you get to read it just because they have they weren't because of IPO and financing reasons they weren't able to attend.
I can do this one. Kocher is a company that the state of California worked closely with as one of the labs that actually pivoted from their initial business, which was largely cancer diagnostics and genetics, to actually scale up dramatically to do COVID-19 testing. Kocher became the group that did the collection of samples and the test for the city of San Francisco. They then expanded to work with Marin County and Alameda County. They got FDA approved for a new methodology COVID-19 testing that had a couple of advantages. One is it had a different supply chain, and so they weren't hand-tied by the absence of RNA extraction reagents and swabs. They have a saliva-based approach, and they have incredible turnaround time. So one of the big issues now that we're facing in California is that the average test is taking 4 or 5 days to come back, and that really reduces the usefulness. Kocher's consistently had 24 to 48 hour turnaround times, and so they've been a great example of innovative partnership and somebody that really stepped up in a patriotic way for COVID. So that would be, I think, what Offman would say if you were here.
I think it's he would be proud to hear that.
And now we have Scanwell.
Hi, everyone. So I guess, yeah, to maybe just run through what's unique about Scanwell is that we're focusing on completely at-home tests. And so, Scanwell, we started off kind of with our vision of making healthcare quicker and easier through at-home lab tests. And so when COVID struck, we really try to focus on these rapid COVID tests. And these are tests completely done at home by a layperson with nothing mailed back to a lab so that patients can get results in real time versus days. And so right now, in terms of what we have both we're working on both a rapid antibody and a rapid antigen test. Our antibody test is being validated and used by over 10,000 people right now in North Carolina as part of a large serosurveillance study with the state of North Carolina. EUA is pending, very close, I would say. And on the rapid antigen test side of things, also pending right now with a couple of big partners that we are basically working with. Ultimately, these types of tests, we really think about it in terms of scale and accessibility. And yeah, to kind of get out of this situation that we're currently in, rapid testing, daily testing, to be able to deliver these types of tests, at scale and in a truly accessible manner, using a device that, for the most part, everyone has already in their pocket in terms of a smartphone. You're able to then do a lot in terms of also connecting that layperson, after the test results, to additional care if needed or additional testing if needed. So that's kind of what we're working on right now. And yeah, just honored to be kind of considered amongst everyone here. I just think anyone working on obviously COVID is a winner already, in my opinion.
Steven, what's the cost of the test?
So these rapid lateral flow tests are very cheap. They are, on the scale of dollars in a sense. And yeah, that's also another kind of key differentiator here is to, again, enable that rapid accessible testing. You do have to think about the cost of these devices.
What's the timing of the EUA, do you think?
So for the antibody EUA, we're hoping in the next month or so. Things are, we've been kind of in talks with FDA for 4 or 5 months now. And so a lot of the work that we've done has kind of also, in a sense, impacted the way they've thought about kind of their templates for these EUAs. And so it's been very nice working with the FDA. They've been very kind of supportive in that sense. And so, yeah, close to there on the antibody, and then the antigen probably by the end of the year.
Great. Thank you. All right, onehealth.io.
Hello, my name's Nikhil. So what we do is provide testing as a service. And we were the first to get the EUA for at-home saliva testing in late March, early April. And what we do to provide testing as a service is we solve two problems. First of all, you want to enable Americans to be able to get testing wherever they are, in their doctor, their hospital, their company, their school, their summer camp. We have the ability to put a branded website with your brand and COVID testing in a day. We also are able to enable testing on your app, like we've done for some of the other finalists. By doing that, the apps that we have enabled manage about 15 million lives. The second problem is about 80% of the testing done in the United States is fragmented, and it's not the big guys doing it. So we partner with many different labs to try to aggregate that level of testing and provide an easy software solution for everyone else. But because a lot of these labs may be smaller university labs, the only way to access these labs is through us, because we're essentially running the internal lab software, doing the reporting to the government, providing the data, and it's for we're the people doing the IFU for the FDA. So due to this, we've launched some of the important innovations like the at-home saliva test.
Great.
Thank you. Biosciences.
Hey, yeah, excited to be here. Sorry I don't have the background. My computer can't handle it. So look at the beautiful background we have here. Yeah, so at Mammoth, we're really focused on leveraging a tool that's usually thought of as a gene editing tool, which is CRISPR, but in a really exciting new way, using it for diagnostics. And I think the way we see diagnostics generally at a high level is that right now you kind of have this choice. Do you want a result that's molecular and has the highest levels of accuracy, like something like a PCR or qPCR digital droplet, but that result's going to be something that's done in a lab and something that takes a long time to get the result back and needs a lot of trained personnel and a lot of steps going on? Or do you want a really awesome result that can be done really rapidly and accessibly, but it's not going to be molecular, and maybe that includes some trade-offs around things like sensitivity and specificity. So with these CRISPR-based diagnostics that we're building, really we're trying to bridge that gap and create things that are in the format of a pregnancy test, but that allow you to have molecular style results that you would get in a lab. And on this journey, we've gotten a couple of EUAs for various flavors of the chemistry. These are all, to be clear, in the lab, but that's the same type of chemistry that we're working with organizations to put into this kind of at-home or point-of-need format. And towards that, we have a partnership that we've signed and it's public with GSK, where we're working very closely with them to adapt the chemistry to this at-home format. I expect to launch that sometime next year. And we also, you may have seen, had a contract awarded by the NIH to scale the lab-based testing. I think that's a testament to the excitement for what this technology can do at kind of both barbell ends of the spectrum, which is very unique. So even in the lab, we can scale the capacity and the ease of doing testing through this really simple chemistry. And then that simple chemistry can also be applied in this at-home format to create just a brand new class of molecular diagnostics.
Are you doing the lab format now?
Yeah, so we're actually, that's rolling out at massive scale in the next month as just, it's a public information with their NIH contracts. That's scaling to millions of tests.
And is the advantage that this is a different supply chain and faster turnaround time but similar accuracy to PCR? For the lab-based, what's the advantage?
So different supply chain, fully integrated, very fast, and the same accuracy. So it's like you get to have your cake and eat it too. And excitingly, actually just a month ago, a group we'd never talked to over in Europe and the Netherlands actually took our chemistry and reproduced all of it and benchmarked it against PCR without us even providing reagents. And they published a preprint saying chemistry matches with PCR almost exactly. This is amazing. Where they had every incentive to say like, this is crap. So that was another great validation point. But also to get the NIH contract, we had to go through a ton of validation internally with them.
Excellent.
Cool, thank you.
Well, good. Well, those were the, basically the question is, and we could do it this way. Bob, if you want to basically fire off a few more questions on this first group of companies, or you want to let's move forward with some of the other panelists. What would you like to do?
I had a quick question for Nikhil on onehealth.io. When does the home saliva test launch?
The home saliva test was launched in early April. It was launched.
All right, and the home saliva test is they produce a sample at home and they mail it to a lab, and then the 72-hour turnaround time is from mailing to the lab getting results back?
Yeah, so they do it at their home, they send it. Right now, what we're saying is we have about, once you get to the lab, 95% of tests are turning around within 48 hours. That 72 hours that you saw was from the time they mail it, because most of those mailers are overnight, and your average is much lower than that. So that 72 hours is from the time mailing to receiving results.
And what's the price?
It depends on the bulk. A lot of times we're selling to hospitals, etc. But for the retail prices, they're in like the total package in the 130, 140 range, but they're below 100 for most of your hospitals.
Thank you very much. I appreciate it. All right, Mark, those are the questions. How do you want to do the discussion, Mark?
What we're going to do now is we're going to introduce Michael, and Michael's going to he's going to walk through the next four companies. Michael, are you on? Yep, I see you.
I am right here.
Hello, how are you?
Great. How are you?
Michael is a new board director. He's on the UCSF board of directors. He was super early involved with Rock Help as a funding advisor. And Michael, want to tell us a little bit about yourself?
Sure. I'm a medical physician by training. I did my training at Mayo and moved to more innovation and business development. I was at Mayo for 3-4 years, working in new ventures and BD, and then came out and joined Montreux 8 years ago. We're a diversified healthcare fund. We've moved more towards growth investing over the last decade, and I lead our software and services investing. And so some of my companies like MindBody Online, Tiger Connect, if you're familiar with them, Cario. So it's a real pleasure to be involved with what you guys are doing here and at Health Hub. And this is my first awards program. So I'm
bring it on, baby. All right.
Dove right in and I'm kind of getting through it, but I feel really honored to be, talking with such an awesome group of companies, and, what a great time to be doing health IT, despite the, issues with COVID. Obviously, I think it's brought speedlined a lot of these new solutions, and it's a real pleasure to be here.
Great. Well, here's what you get to do. These are the questions that we had asked the companies, and here are the you get to introduce these next 3 companies.
All right.
Yep.
Awesome. So Abner Masson from did I pronounce that the last name correctly?
It's Mason, M-A-S-O-N, Mason.
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 Sorry. Mason. So, great to meet with you and have you here. Is it better, Mark, that each company presents themselves for a few minutes, or?
Yeah. So what we do is basically just you'll make the introduction. GoodRx, because they are in a quiet period with an IPO, they could not join us. She'll just make the introductions, and you'll sort of drive some of the Q&A at the end.
Perfect. Okay. Then, obviously we have Dr. Ian Tong, CMO at Doctors on Demand. Do I see him on the list? People here? I do. And Aditya Bansal, co-founder and CEO of Luma Health. So,
hello.
So great. So let's get going, and then I have some questions, and we'll have a great dialogue.
All right.
Great. So I guess I'll just take a couple minutes to describe CasejoSano. We're a patient engagement, patient navigation company. The problem we're solving is that our country has changed over the last 4 or 5 decades. We've become much more multicultural, but healthcare in America hasn't kept up. And that results in a mismatch between the ability of the healthcare system, its ability to serve. In fact, our healthcare system just isn't well equipped to serve the country that we've become, or all the people that call this country home. The way healthcare stakeholders now engage patients is primarily the old school approach, which is You design content for English speakers and then you translate it, usually not well. That approach doesn't build trust. And what we need now is trust in our health system. And so what we're doing at CasejoSano, we've turned that on its head. We think that you need to understand who people are culturally and then design content based on culture. So we built a technology platform that allows us to ingest a lot of data, public data, private data, claims data. We have an incredible team that really understands how these consumers, these healthcare consumers, multicultural, low income, undocumented, how these folks consume healthcare. And then our platform allows us to micro segment the larger population into much smaller groups we call cultural cohorts. We design the content for the cohort. We then deliver that content in the mode that patient prefers. And we're just getting incredible results. And in the era of COVID, where there is so little trust in our system, you know, if you look at polls now, even if we had a vaccine, most Americans wouldn't take it. And if you look at minority groups, you're talking 60, 70% of people won't take it. We need to figure out how to make sure going forward that we stop treating people like who they are doesn't matter. And that's what we do today. When we use a one-size-fits-all engagement approach, we're saying who you are doesn't matter. Where you come from, where you live, what you hope for, your fears, your experience with healthcare, you know, social determinants, all that stuff isn't important. But the fact is, it is important. And we've got to, and what we're saying is if we can incorporate that into our engagement, we'll get better results and we'll be able to navigate people through the healthcare system. And that's what we're doing at CasejoSano.
Nice.
Oh, that's great.
Yeah, I just want to, I guess Dr. On Demand will be next. So I'm Ian Tong, Chief Medical Officer at Dr. On Demand. I want to thank Abner for definitely for the points that he made, and congratulations to everybody that is presenting today and has gotten here. And I want to thank UCSF for doing this, because not easy to do this, especially given some of the input from some of the attendees there that I think I saw in the chat. So I really want to thank everybody for stepping up to do this today. Dr. On Demand, one of the best ways to see it, Michael, is as a 50-state medical practice or national medical practice of employed board-certified physicians. We are a virtual primary care platform as well as behavioral health platform. We actually launched virtual primary care with our employed practice over a year ago. And so this is prior to a COVID-19. This is prior to the need to have a virtual platform through which you can engage patients and actually perform healthcare delivery to those patients. So, and we actually were very fortunate and honored to be recognized by UCSF last year for that virtual primary care platform, which is called Synapse. Fast forward to where we are now, 7-8 months now into this. Dr. On Demand pivoted very quickly at the very beginning. We were the first, or one of the first, actually in early February, prior to COVID-19 being called a global pandemic. We actually launched a risk assessment. So we actually did a risk assessment identifying the high-risk patients, and then midway through COVID-19, as we were seeing increased volume. When I say midway through, I should say within the first few weeks. So midway through the first month of COVID-19, we modified that risk assessment to actually help us triage patients, and we did so in coordination with the CDC using their guidelines. So we were able to create an asynchronous tool that allowed us to risk stratify patients and triage them to facilitate visits for the higher risk patients or the sicker patients in that group. What we saw in the first few weeks was 400%, so 3 to 4x demand of our services in the first 4 weeks of COVID-19. Dr. On Demand was able to onboard doctors from 23 different specialties. We also doubled the size of our own practice. We could have gone beyond that, but within 4 weeks, we were able to really scale to where we were able to double the size of our practice and meet demand all the way back to our pre-COVID wait times, which are about 5 to 7 minute average wait time. So we created and scaled our platform to be able to engage as many patients as possible, both through asynchronous risk assessment, but also through our ability to scale the practice and see patients and engage them in synchronous actual visits. So the ability to do that very quickly was extremely useful. The thing that I would say that goes forward from here, though, because this is an employed practice, so it's not just a one-off, it's not just a COVID pivot, but actually what we've been able to do is with our virtual primary care platform, we're really in place and already had flipped the model on its head to say, prior to COVID, there is a need for patients who are not engaging primary care or not able to access care, just as Abner said, in its traditional format. And they can do that virtually through this platform. And so we were ready really and did not have to make a major pivot. the point I wanted to make about having the employee practice is that these relationships and these patients are going to need to get care ongoing. They're going to need care post-COVID. They're going to need care through vaccinations, and so on. And so we have a relationship that we are creating with that patient, and we actually just published a peer-reviewed paper in the Mayo Clinic Proceedings Quality and Innovation Journal about the fact that patients do establish relationships through virtual care. And then on the quality side, we also just published a paper in Journal of General Internal Medicine that allowed us to show that we actually can engage patients with high quality.
Okay, I want to just give another 5 seconds or so. We just have
yeah. So just to wrap it up, I want to just agree with Abner's last point, which was being able to meet patients where they are. So I think a very unique thing about our practice, other than being employed, is that almost 50% of our doctors are ethnic minorities. 21% of our doctors are African American. 5% of the doctor population in this country are African American. And the final point is 20% of our practice is LGBTQ. So we have created an inclusive practice of professionals that can actually help meet these patients where they are. Thanks.
Awesome.
Awesome. My name is Aditya. I'm one of the founders here at Luma Health. And first of all, I'd like to thank UCSF for the opportunity to be among a list of esteemed COVID patriots here. So very excited this opportunity. We founded the company Luma Health with a very simple and straightforward mission that it's hard for a patient to be able to see their physician, and it's hard for a physician to be able to connect with their patient after they've left the four walls of healthcare. And so over the last 5 years, now coming up on 6 years, we were building a set of solutions to help patients navigate the journey just to make it easier to get access to healthcare. And when COVID reared its ugly head at the beginning of the year, we started to see the concerns of patients coming up in the patient messaging, in how they book appointments and how they communicate with their healthcare providers. And we turned and pivoted a large component of our team to start to build solutions to really help clinics address the needs of patients as they continue to get access to care over the course of the now last 7 or 8 months. Over the course of the pandemic, we released 3 products, including the ability to turn entire clinic schedules into telehealth. We built a telehealth solution, a physician-facing telehealth solution in about 2 weeks. An ability to do broadcast messaging at the scales of about 10 to 100,000 patients an hour, where an entire health system could shut down if necessary due to an increase in COVID infections, or as it came out in the summer due to potentially civil unrest and other other issues that were happening within large metro areas. And then we also released a zero contact check-in product, which allows patients to stay inside their cars when they did need to come in for those ambulatory visits. So over the course of the pandemic, we've messaged, communicated with, checked in, had delivered encounters for 7.2 million patients over the course of working with about 19,000 providers. Going from the initial ideas that we had back in February and March to deployments in health systems, clinics, and private practices very rapidly to kind of deploy these solutions to let patients feel safe to come back in for care and let clinics stay in business. So we're excited for the opportunity to share with the community at large what we've done, the little work that we've done to help actually amplify the work that physicians do to get access to patients.
Okay. And then
GoodRx.
Yep. I guess everyone's reading in the news now that they're on their IPO process and their quiet period. So, well, awesome. I mean, I think, Mark, if that's okay, I know we're running tight on time, but I'd love to ask a few questions to the group here, and 30 seconds each. So, okay, should we ask these questions then, or
it's your agenda? How about this?
Okay. Well, one of the things I wanted to talk about, and I think it's so interesting because these are the best patient engagement solutions. And one thing we know is, when you're directing things to consumers, how do you keep them engaged into the future? And I think what's happening now is with telehealth and the emergence of telehealth and all these wonderful solutions that are out there, patients and consumers are being bombarded with all types of different options, if you will. So it'd be great to go around and just hear briefly what makes your specific solution unique and differentiated, and how do you think that will allow your patients to be and customers to continue to be engaged in the long term? So maybe we start with CasejoSano. And you know, what would be interesting maybe with this specific company, one of the things maybe as a sub question is, could you tell us a little bit about how the model works too? Are you providing the telehealth solution, or are you a accessory for other providers to create this cultural content?
Sure. So let me just make sure yeah, you can hear me. So I think what we're doing, I think it makes us unique in the marketplace, is that by starting with culture and really understanding who people are culturally, but doing it at scale. So it's a lot of data to understand that. And we do a lot of A/B testing and building algorithms that allow us to collect all of that data, particularly public data and private data, at the zip code level, at the community level. And that allows us to reach out to that patient in a way that they've never really been reached out to before. I'm saying this, not sure you all believe it, but healthcare really does treat people like who they are, doesn't matter. And that's the way we engage, and we've been engaging. But we're moving to a period where people expect better. They get better treatment from Netflix and Amazon. You buy one thing on Amazon, and Amazon figures out who you are and starts to treat you like they know who you are. They care about who you are. We don't do that in healthcare. And so that's what we're doing that's unique. Our business model is typically we work with health plans. Most of our clients are large health plans, particularly in the Medicaid space. And we charge a PMPM across the whole population. Typically plans hire us because they're trying to close gaps in care in, for instance, the Medicaid program, meaning they need to get every child vaccinated. And these are people who are low income, they have low health literacy, it's hard to engage, and the plans struggle, they get nowhere. So they call us and they say, you figure out how to build a trusted relationship with that member and navigate them into the clinic. So we're not the telehealth solution, we navigate people to a telehealth solution.
Got it. Great. Okay, Doctors on Demand.
Yeah, sure. Thanks for the question, Michael. So differentiator for us is I'll just stress, I said it a few times, but I'll stress it one more time. It's an employed practice. So when you employ the clinicians in your practice, you can actually establish that relationship. So
it's continuity. So that's your physician that you're going to be seeing.
Right, exactly. And so what we did, and our very similar to Abner, our original clients have primarily been health plans and large employers. However, and that's where we've launched our virtual primary care platform. But we actually just announced, and it was on the slide, so I didn't mention it, but Medicare, we were the first telemedicine practice to actually enable Medicare recipients, Part B, to actually engage and go through the app and be able to see their eligibility, copay, and have a visit. So that brought us from around 50 million to 98 million Americans who can actually access us through the app now in a very seamless way and be able to have a visit and then have that relationship ongoing. I think that's the reason why we're the first to do that. It's very difficult to do that if you don't have the engaged clinician within your practice. That's great. That's how we've done it. And yeah.
And sorry, we're running out of time. Luma.
Sure. So when we work primarily with physician practices, health systems, the actual provider networks themselves. And when we think about patients, we think about them as people who have like complicated lives. A lot of every patient's the tip of the iceberg. What's under the waterline is very complicated. And our way that we approach, how do we make sure we message, nudge, and push patients along their journey successfully without overwhelming them, bombarding them, and all that sort of stuff? It's actually kind of technical in some ways. It's with deep integration with the EHR. So we integrate with 75 different EHRs and PM systems, from the likes of Epic to things that you've only seen in like upstate New York, that we really use to help coordinate that entire communication and care journey with the things that are happening under the waterline, that the diagnoses that are happening, the SNOMED codes that are occurring, all the different parts of the patient's care plan that are evolving as their care in their entire their experience with their physician continues to evolve. So we kind of work very closely hand in hand with our physician partners to build these sorts of care journeys, embed them into the workflows of the EHR to let them have a very seamless and frictionless experience when they come to engage with their healthcare providers.
Okay. Did we make it on time, Mark? Oh, you're on mute.
No, I'm off mute now. No, you guys it was great. What a great group. I'm glad we had just 3 companies. Thank you, Michael. We're going to move. Stan, I saw you out there. Are you demuted? Yes.
I'm unmuted now.
Perfect. Let me quickly introduce Stan, who's going to walk us through the next 4 companies. Stan and I know each other pretty well. We've been spending a few years together. He runs HitLab, which is in New York City, probably the digital health accelerator. Really exciting place. And but Stan, I'll let you introduce yourself a little better and talk a bit about HitLab, and we can get into the companies.
Yeah, thanks, Mark. And good to see everyone. Thanks for joining us here today. This is a really exciting event, and looking forward to hearing more from all of the companies and everything that we're doing. Just for folks that are unfamiliar with the lab, we're not necessarily an accelerator. We're a digital health testing lab where we do a host of different types of technical, economic, experiential, and clinical testing. And we don't take equity and we don't own any intellectual property. So HitLab is a little bit different along those lines. And then I'm also the director of the digital health program at Columbia Business School, and run a 4 certification program, one of which is starting next week on Friday in digital health strategy. If you would all like to get the friends and family health hub discounts, please contact me on LinkedIn, and would love to get you involved in certifications and meeting some of the best and brightest in digital health certainly at the business school and across a lot of the spectrum with companies like Apple, Google, Amazon, et cetera, guest lecturing there as well. So with that, we want to walk through the semifinalist interview process, and we want to, first of all, understand what's unique about their solutions. Number 2, we want to find out what about their existing user journey is interesting, and what does it look like. Number 3, we want to hear more about their validation. Obviously, the 650 plus studies I've done over the last 25 or plus years, verification, validation is very important, and we'd love to look at those. So how are we using evidence to help promote the diffusion of our products across the ecosystem? And then lastly, where will the next 5 years take you? And that's clearly a cornerstone of this. And we have 4 brilliant companies, and we want to hear from each of them and understand what they've done and how they're doing it. First, Carbon Health and Caesar and Greg and Qventus, obviously Fahad and what's going on at Caremerge, and then Russ and Glooko, just a terrific company there as well. So these COVID Patriots are just spectacular, and we want to first hear from Carbon Health and what they do. Carbon Health.
Hey, thanks so much for having me. I'm Caesar Javaharian. So first and foremost, Carbon Health runs clinics, telehealth, and we integrate with health systems. And we're doing this across the country. We're now in 50 states. Basically what we do is we've used technology to personalize and scale healthcare delivery. And our journey started with coronavirus on January 23rd, when we had in our Mountain View clinic, probably one of the first cases of coronavirus to be identified in California. And so from January 23rd on, we put together our engineers, our physicians, our operations team, and within days had a symptom tracker to risk stratify patients who are coming in, so that we could keep our staff safe, so we could keep other patients safe when we knew what they were coming in for, and filter them based on, at that time, travel. Now it's a much more extensive risk stratification process. We're using data on the back end. So because we own and have developed our own electronic health record, we use data to optimize our care based on what people are coming in for. We've done over 230,000 tests since March for coronavirus. So we have one of the largest data sets of people who test positive or negative, whether they're symptomatic or not. And now we're translating all that experience where, the 230,000 patients that we've taken care of who've been tested by us, we haven't had any of our employees get coronavirus. So we've been able to keep them safe. And so we've translated that experience to helping other businesses reopen we're now doing that from New York to Seattle with quite a bit of success. So.
Great.
Absolutely spectacular. Thank you for that. And Caremerge.
Hello, everyone. Thank you for the honor and opportunity. My name is Fahad Aziz. I'm the co-founder of Caremerge. We provide a wellness and clinical platform for senior living communities. We are being used by over 450 communities in 39 states. When the pandemic started, one of the first few reports of COVID came from a senior community out of Washington state. And that created sort of a media frenzy, but it also created a lot of panic for 40,000 plus communities that are in US, which were not prepared to manage or deal with this type of challenge or problem. So as you understand, this is a very high touch industry. Nurses and caretakers have to go into the apartments, take care of older adults, provide them food, take them for activities. Now suddenly they have to stop doing all that stuff and have to end up leaving the residents in their apartments on their own. Even the family members were not allowed to enter the building. So at Caremerge, we came together, and within a few days, we put together a capability we called crisis management feature, which allowed all the communities to be able to send messages, updates, voice through Alexa and other places, what's going on with the community and COVID updates. Within a few days of launch, over 350 communities signed up. We gave it to everyone for free, and they started sending messages. And within a few weeks, over 1 million messages were sent through this platform. And we started seeing the results. One of the community that has over 900 residents, they published a case study a few weeks back where they talked about how this timely communication helped them in their containment efforts. And also meet with the compliance needs. As you may also know that a group of senators reached out to leading operators in senior communities and asked them for data of what they have done during this time. And all our customers were able to provide that because of the data that they had in the Caremerge system. So we feel very honored to be part of this journey and being able to help our customers who were in deep troubles.
Fantastic. All right. Wonderful. Thank you very much. And congratulations again, Qventus.
Great. Hi, everyone. I'm Greg Schneider. I'm the Chief Marketing Officer from Qventus. And thanks to the UCSF team for sponsoring the awards, and congrats to all the participants. We are an AI-based system for automating healthcare operations. So we integrate with EHRs and we apply AI, machine learning, the principles of behavioral science and operations management to really drive operational efficiencies through health systems. And when the pandemic hit, we started working super closely and very intensely with our partners to develop new COVID solutions on top of our existing operations platform. And those there are essentially 3 different solutions. The first are COVID planning tools. These use the AI coupled with 450 epidemiological models to plan for critical resource constraints and COVID cases at the individual hospital level. And so a lot of the models out there plan at the kind of the regional level, but not at the individual hospital level. Moreover, then we introduce tools that allow scenario planning and analysis, as well as planning for elective surgeries, for PPE consumption, for post-acute demand, and so forth, all at the local hospital level. We made those tools available for free, and they have been proven to be between 2 and 20x more accurate than some of the other models out there. So I consistently hear from our partners that this is the most accurate tools that they've been able to find in the public domain. So that's the first set of tools, first set of new solutions for COVID. The second is critical resource mission control. This is built on top of the existing platform, and it gives incident command centers real-time visibility into the critical resources within their systems. So that's negative airflow isolation rooms, that's vents, that's ICU beds, that's med-surg beds, et cetera. And that is across individual facilities as well as across their broader systems. It's surprisingly difficult to get that visibility, and makes it very challenging to load balance. Third, I see the slide advancing. The third category is then capacity creation. So it's fine to plan, it's fine to identify resource constraints, but then what do you do about it? And we've introduced ICU and med-surg capacity creation solutions, which again use the same AI and machine learning to identify candidates for early step down from the ICUs, to identify candidates for med-surg discharges, to really unlock additional capacity within the system with the existing staff. The solutions, we're super grateful to be helping over 1,100 organizations throughout the country, everyone from large health systems to local and state health departments like the state of Minnesota, up through the very highest levels of the federal government like the White House. I'll end there.
That's terrific. Thank you. And Glooko.
Great, thank you, and a big thank you to UCSF. And again, like others have said, honored to be a part of this esteemed group. And looks like maybe I'm batting cleanup on this part of the program. So a little bit about Glooko. We are the largest diabetes connected care platform in the world. We've got a device agnostic solution that we've deployed in 26 countries and 15 languages. And we've got nearly 1 million people with diabetes that are being actively managed through the platform now. We're deployed at over 7,500 clinics globally, and we're sitting on top of over 20 billion data points, which makes it really the largest real-world database for diabetes that's out there. What we provide is really the only universal connector for people with diabetes and their care teams. And it's really about clinics and care teams being able to access all the patient data in one place and get the data, the analytics, the insights that they need to really be able to deliver highly personalized care and decision support. We do that by collecting and unlocking the power of the data that comes off of blood glucose meters, continuous glucose monitors, insulin pumps, insulin pens, activity trackers, et cetera. And we bring the insights together in one place. The data is really easily uploaded remotely, either via mobile application or in clinic. It's securely shared and visualized in charts and graphs that are highly actionable. And what this does is creates a solid foundation for patient-provider collaboration around the treatment of this condition. The platform itself is compatible with over 95% of the diabetes devices that are out there and available, and it really gives people with diabetes and their care teams freedom of choice in those devices to be able to use the devices that are most effective for them. As relates to COVID, when the pandemic hit, the first thing we did was make the decision to make our secure, privacy-protected remote care solution available free globally at with no charge to any health system, hospital, or medical clinic anywhere that wanted to use it. And we did this as a public service to really ensure access to remote diabetes care during this time. And really in an attempt to help minimize the risk of possible exposure to the virus for people with diabetes by helping them avoid going in for an in-clinic visit, but still allowing them to maintain their connection and collaboration with their care team. So it's really quite an easy solution from a patient journey perspective. Patients, clinicians are able to sign up. We can get them onboarded same day in a couple of hours. It's all cloud-based, web-enabled. There's nothing to install. And the provider can then invite their patients to download our free mobile app from the App Store or Google Play, and they can easily sync the data off of their devices and share it with their care team. So it all happens in a very secure and private connection. Okay. So, the other piece I would just add, because we are diabetes specific, and if you think about just this population specifically, there are over 450 million adults around the world that have diabetes. This number will be 700 million by 2045. And people with diabetes do face a higher chance of experiencing really serious complications from the coronavirus. In general, people with diabetes are more likely to experience severe symptoms with any virus, but their risk of getting very, very sick from COVID-19 is likely to be a lot lower if their diabetes is well managed. So we're really helping support them in continuing to manage their chronic condition, whether they're type 1 or type 2, throughout a time period when they really can't go in for an in-clinic visit. So it's deployed for free globally right now during the pandemic, and it's helping people stay out of clinic and stay safe and really reduce sort of the overall cognitive burden for both patients and physicians as they're managing this condition. So thank you.
Stan, how do you want to wrap it up?
No, that's fantastic. Thank all four of you for doing that. Do we have time for me to ask them these 3 questions?
Fire away with some. We probably got 2-3 minutes of total questions. Go for it.
Okay, fantastic. All right. So again, if we could, let's have each of the finalists here, the semifinalists, fire away at these 3 questions, and you know, again, try to be as quickly as possible. And we'll start with last first. So Glooko, you're up.
Great, you bet. So in terms of question 1, I think the way that question is supposed to read is that why would we be on the top of the list if we're spending money on this? I think the bottom line is, for this specific highly vulnerable population, we are helping to save lives during the time of pandemic. So putting your money there is a good way to help manage the chronic condition through this time when people cannot be seen in person. How many people have we impacted? It's hard to say in terms of actual number of people. Our free remote care offer that we put out there was adopted pretty readily. We had over 130 health systems and hospitals sign up for that across a dozen different countries. And in addition, we've seen about a 45% increase in remote data syncing from our users in general, which again, we've got about just under 1 million active users in our platform today. So I'm not exactly sure about the numbers we've impacted specifically from that, but it's really been taken up strongly in this COVID timeframe. And post-vaccine, you know, we actually are seeing, experience, and believe that the increased adoption in telehealth, obviously we went in the diabetes world from about 5 or 10% telehealth visits for diabetes specifically to 100%. And we know that is settling back down, and we believe that will settle back down somewhere in the neighborhood of 80% of visits that are not kind of acute can be managed remotely. And we think we'll be able to continue to support that going forward.
That's fantastic. Thank you. Qventus.
Mm-hmm. Yeah, absolutely. So I think you know, why spend money on the category of operations? First off, I think one thing has become crystal clear over the course of the last 6 months is that health systems need improved operations. You know, critical resource capacity has been front page news for you know, for the past 6 months, whether it's vents, whether it's ICU beds, med surge beds, PPE, staffing. I mean, it's all front page news. We've heard it described as kind of like washing your hands for hospitals, right? It's something that you should always be doing, but it's more important now than ever before. So we really firmly believe that optimizing operations is critical at this point. And it helps you identify the short-term capacity constraints, get ahead of them, deal with them, and then manage capacity, create capacity to impact patients. That's not only impacting the COVID patients, but that is also, by freeing up the capacity, impacting patients who otherwise would have had their elective surgeries canceled. But because of better planning, you're able to maintain those elective surgeries, maintain the care for the non-COVID patients as well. And that's important from an access perspective. I think the other thing that I touch on then, so impacting, you know, 1,100 health systems, both their COVID patients and their non-COVID patients. And then what happens post-vaccine? This is what's really interesting here, is that improving operations is one of the few kind of no regret moves for healthcare leaders today. It allows them to address really many of the key challenges that they're facing. It helps to increase revenues. It helps to decrease costs, so big improvement in terms of margins. It helps to reduce caregiver burnout because you're reducing the cognitive load and making their lives easier. And it improves the patient experience through better information, through shorter hospital stays, not having well patients remaining in beds. And in that capacity then, Qventus is really impacting not only the short term, so creating short-term value in surviving COVID, but helping companies, helping organizations create stronger organizations for the longer term through that improved operational efficiency.
Fantastic. Thank you, Qventus. And Caremerge.
Yeah, very briefly, you know, in terms of the number of people impacted, if you look at the number of messages sent, for over like 50 to 60,000 people received those in a very timely fashion. So we believe those people and their family members were impacted and were able to contain the COVID spread. In terms of what's going to happen post-vaccine, before the pandemic, we were very focused on creating personalized wellness programs for older adults so that every senior can live in a life so they can live happier and healthier using some AI tools. And what this pandemic has done is has expedited that development, because now more older adults have access to technology. They're more open to it. They want Alexas, they want phones and all that stuff. So it has helped us build those tools and make it available to them so that we can help them live healthier.
Great.
Fantastic. That's short and sweet. We like that. That's fantastic. And then last, but of course not least, Carbon Health.
Thanks. So actually, I'll take the last one since that's a fairly common question. What happens post-vaccine with your business and solution? So, we started out the year with about 100 employees at our organization. In August, we hired 300 employees just that month alone. We'll be maintaining that pace of scaling. And the reason is that we're growing our clinic footprint from in the teens at the beginning of the year to about 150 clinics around the US. And even more than that in the subsequent years. So we're doing that to be able to actually administer vaccines, to have people in communities to give the vaccines, and then to create health hubs where much of the care is done online through virtual, and then people can come into these very low profile, cost-effective clinics. So in terms of how many people we've been able to impact, clearly, if we've done 230,000 tests, we've continued our regular clinical operations from day one. We've never had to shut down. And so the impact is probably on the order of millions of people now, given the downstream impact of transmission. And then if you had $10 to spend, I would say that, frankly, you didn't have to spend any money. A lot of what we do is on education and prevention measures, rather than forcing people into high expensive healthcare. So
that's great. Well, thanks, Caesar. This is amazing. Well, I'm Stan. I'm going to I want to get everything and look to wrapping it up at this point. Look, we've gone a bit over, and but first of all, congratulations. All of you guys are complete winners. That's the understatement of the world. What it is you're doing, it's super important. Wanted to, thanks go out from everyone at UCSF, everyone who's associated with this program in terms of what it is you're doing. And I know I speak on behalf of the other two moderators for basically saying thanks, guys, and good luck to you. I wanted to announce what we're going to be doing next week. So next week, Bob Wachter, for those who don't know Bob, he's the most sort of actively tweeted person out there on COVID. He runs the Department of Medicine at UCSF. He's known as the Digital Doctor. He wrote the original book, Digital Doctor, a number of years ago. He is going to be emceeing our COVID section. So he is going to be giving all of you your awards. We have a number of special guests that are going to be joining us next week. And we're really excited about, again, it's been a terrible year. 2020 has sucked for so many reasons, but we're going to celebrate you guys and what it is you're doing and how if it wasn't for you, how much worse everything would be. And that's why we're going to treat next week really as a celebration. And that's our grand finale next week. It is to celebrate, the greatness that companies like yours and in the other categories have all done. For those, tweet out and tell your friends, tell your cousins, tell everyone to come to our event. It's a live event, 6 to 7:30. We've done it purposely so that people are at home. They might have a shot of tequila next to them. We want them to sit back and reflect the fact that, look, all of you guys are doing amazing things, and this is an amazing celebration. So really with that, I wanted to thank everyone here, moderators, companies, you guys are great, and good luck next week, and have a good rest of your day.
Thank you.
Thank you.
Thanks, Mark. Thanks, everybody.
Thanks, Mark. Congratulations, everybody.
Thanks.